Good day, everyone, and welcome to this very special conversation for the NuMIQ newsletter and YouTube channel. Today, our guest is Professor Salaminah Moloko Phiri. And Prof Salaminah, you are so welcome, and we are looking forward to what you are going to share with us.
Thank you very much, Prof Emarentia, and it is really indeed an honor and pleasure to be invited to this interview. I think I really appreciate it. Thank you.
Thank you. Kindly tell us more about yourself. You are the research coordinator in the NuMIQ research focus area and also a renowned researcher and leader in nursing. So please tell us more about yourself and your research.
Okay, I will start with my research, my own research. I obtained my PhD in 2015 from the University of Pretoria, and my focus of my PhD was on indigenous knowledge, particularly the use of proverbs and how they impact on health. And the proverb that I focused on is named lebitla mosadi ke bogadi. Someone once said to me, don't translate it because it loses meaning, but for the sake of people who do not understand, I will translate it so that they understand what it means. Yeah, what it means is, as a woman, when you get married, your grave will be at the husband's place. You leave your family, you go to your in-laws. That is where your grave should be. And when a woman gets married, during premarital counseling, this is the common proverb that is being used to say, you are now married. And now the place where you will die should be at the husband's place. But, there are many things that come up or that go along with that proverb. Now, in my PhD, I interviewed women. These women who are married told me, the questions were, tell me about your experience of the proverb, how do you experience it? And these women said to me, let me start with a positive. Of course, there's always the positive side for every story. The positive side, they said, majority of them, because I think I had focus interview, I started with individual interviews, but these women said, we think if we can meet with other women, we'll enjoy it because we'll see that we are not alone in this, and maybe that can work as a therapy. So I said, okay. Maybe let me start by saying, let's interview you, but then we'll organize a group. So I organized the focus groups. Initially, I started with 5 women, and thereafter I organized a focus group. And remember, the women, where did I find the women? I found them at churches and at the society. The society where they hold their sort of stock fair, where they hold meetings and so on and so forth. So now these women said, One woman said, no, I prefer to use this proverb. I will use it for my children. I've got 2 girls and I'm going to use it when they get married because I think it makes a woman strong and it makes a woman to be grounded in the relationship and in marriage. And because of that, the woman will know that I have been married and I must stay here. But again, well, there were some women who also said, we can't change it. It has been there from time immemorial. It has been there during, our great parents practiced it and they never experienced problems. But then some women said in the negative side, yes, this is a good proverb, but however, it needs to be looked into because some people, believe that a woman who is not married does not have rights. It sort of says to you, you cannot do anything because you are married. You cannot go back home. And one woman said, you know what? When I go back home, I'm told you don't have a room here. You cannot come here. You don't have, if you come, you can just come and visit, but you cannot say, I have problems in my marriage, therefore I'm coming back home. You do not have a room. Where are you going to sleep? Where are you going to stay? And some such things brings pain to other women. They believe their parents, have just sold them away. And that brings issues of depression. Some women can't take it. I remember one woman telling me that, when I came back home, my mother didn't want her friends to know that I'm back home. And when her friends were visiting, she would just lock me in the room and say, don't come out because people will see you that you are back home. And what is going to happen to me? And this woman said, it brings sort of a stigma, people, families feel when you go back home, you bring bad luck to the family, but they don't know what that does to you. Because she says, at times you want to stay in the marriage, but there are issues that you cannot stomach, you cannot keep up to because they're very painful. And one woman said, for example, I am in my marriage. I was told by women during my wedding, just before my wedding, that, you are getting married, you have to stay in the family. You cannot go back to your family. You have to stay in that in-laws family. But then when you get problems of abuse, your husband uses that. You were told that you cannot go back home. Remember, this proverb rings in your mind that lebitla la mosadi ke bogadi, so therefore you cannot go back. And this woman said, you know what? It is so bad in my marriage that I always want to go back. But if I go back, who will maintain my children? So this woman said, for example, I wanted to divorce, but my brother said to me, if you leave that husband, he will kill you. Sorry, he will kill you. Don't leave that husband because I know what will happen to you. So this woman said, I had to just stay in the family, in this relationship. So I feel trapped. And the trapped women who were trapped came out as the second theme. The first theme was patriarchy, because patriarchy, everyone mentioned patriarchy, where a woman had to be excessively obedient, in the relationship, in marriage. And even though there are challenges, you were told to be obedient and to be there for your in-laws. You were told to find people who are sick, people who are not well, and people who are well, but who will have their own way of thinking. But we have to go along with the family. And the issue of patriarchy being there, they said you can't change it. Males are superior. You as women come, second. Males decide. And when the society tells you that males are superior, you have to always be obedient. You feel that it is not right, especially when some women are suffering in the marriages. And for example, some women even die in marriage. They die in this relationship, but because they were told you cannot go back home, now they can't go back home because because of fear of stigma, that my family will be disrespected. So many things will be said to them that, by the way, your daughter has come back. What can you tell us? And again, women are told, when people are planning for marriage, you cannot be part of the entourage because you have come back from the marriage. You cannot you cannot be part of the people who are, going to counsel the bride, because what do you know? You are beg, you can beg. And some such issues are very painful to these women. Okay, that is patriarchy. And like the second thing that came out of my study was trapped. Women felt trapped in the marriage. They felt so trapped. And when one is trapped, there's nothing that you can do. You feel trapped. You can't even breathe. So women felt that they can't even breathe. You know, in my study, there are even pictures that graphic pictures that I designed, where it shows that a woman is inside the house and she cannot talk to anyone. This house is toxic. The environment is toxic. But this woman is not allowed to even go outside or even peep outside or even talk to people and say, hey, it is bad here. Because you are not supposed to talk about what happens in your family and or in your relationship. And some such things, you know, created stress to women. And you can imagine what is happening to their health, you know. The health get affected. They get psychosomatic diseases or diseases. Some get hypertension, some get depression, some, you know, they were different conditions that they said, right now I'm taking medication. I'm always on medication because I can't cope. I went to see my doctor and the doctor said, you better take this medication. I went for counseling, but it is not improving. But again, there is, what came out is awareness, that people should be made aware that even though a woman is married, there should be a way to listen to her needs, to her problems. She's a human being with needs. And, you know, there should be, when a woman says, it is hot here, and this shoe I'm wearing is very painful, there should be people who are listening, you know, so that they are able to assist and solve problems. And I think if we as the nation and as a family, as families, and I don't know what happens in white families, but in majority of Black families, you know, we use this proverb is used. But I'm saying, you know, my recommendations were that children should be made aware that they should respect rights. You know, boys and girls should respect each other. The respect should start, you know, when they're young. A person must not say, I'm a boy, so therefore I can do as I wish with a girl. Or so it should start, even the education should start at basic level. Once we teach our children, and when we are at home, we must not say, this is a boy, this is a girl, therefore you can do this, the boy cannot do this, but the girl can do it. Because some such things brings up a boy who thinks, you know, because of masculinity, everything will be around him and the women. And that is what leads to abuse, even in nowadays, you know, because some of the children, you know, the education to prevent gender-based violence is not penetrating enough into schools. And we see this, you know, as an ugly monster popping out even in when these children are growing up and even when they're elders or they're adults. We see this growing up. So my recommendations were such that, you know, when we give health talks, we should look at teaching the community on how to prevent gender-based violence. And I know when we teach our families or the community, there is this issue of indigenous knowledge, where, you know, the indigenous people believe that we cannot change our way of living. But even though that should be looked into and say, but how can we improve it so that we don't end up with women who are being abused? And again, awareness. If we keep on having awareness, you know, community awareness and teaching them and asking the experienced women to come and share their experience, their knowledge as knowledge holders to these young ones, you know, sharing, because I know people should respect each other, but once the marriage becomes toxic, one partner, even the children will suffer. Yes, I think in a nutshell, that is what I can say.
Oh, that is wonderful research that you did, and I really think that you managed to reach deep into that indigenous knowledge and culture of these women that participated. And with doing your research, you actually created a safe space for them to share their experience. And I can just imagine that that was a relief for them and a way to share and say how they feel. And it seems to me that you made meaningful recommendations for the health talks and creating awareness, and even just talking about your research results as you are doing now creates awareness and can bring about change.
Yeah,
So
I also want to add that the nurses should also know how to prevent, to teach. As educators should also know how to teach the nurses on how to identify women who are in bad relationships, who are being abused, and how to prevent that, so that in their health education, they are able to communicate that through to the community.
no, definitely, I agree. I think nurses are in the ideal place to do that because they have daily contact with members of the community and women.
Yes, and again, because when we care, we nurse, we care. So during caring, we should also make sure that there is that warmth. And when we create warmth, these women will also be open to us, because at times they are not open to us about the issues that lead to this gender-based violence. Yes.
No, definitely. So you are fulfilling a very important role in NuMIQ. Please tell us more about that.
Okay. I've been appointed here in 2018 as an associate professor, and at the moment in 2020, I was appointed as a research coordinator. Well, I've been acting from 2019, 2018 and so on. So my role here is to teach research and to mentor the young researchers. We are a staff complement of 30, and a majority, or with only 3 professors, 3 associate professors, and 4 staff members with PhDs, doctors. And we are in total 5. Then you realize that the majority of staff members are still reading towards their masters and some towards their PhD. Actually, majority are studying towards their masters, because those who are still, towards their PhD, those who are still doing masters are the preceptors. You know, there's still majority of them are studying towards a master's degree, because the requirement for their enrollment or appointment was just basic degree and so on, but now they're working towards their masters. Now you will realize that these colleagues need to be mentored. When we get students, we allocate students to these colleagues, but we make sure that we pay and mentor them so that we build a culture of research. And let me start with the professors and those with PhDs. We have research, each has a research program. And for example, my research program is on strengthening the prevention and response to violence against the marginalized populations, and populations, that is the vulnerable populations, women and children, elderly, LGBTQI, and even men. Because, you know, when we talk violence, gender-based violence, you will realize that lately, it is not only on women, but although the majority is on women. So I'm looking at getting students who will work on my program. And I have a list of objectives that the students will work on. For example, the first objective is on what is prevalence. The first student that I have given her the topic on that, prevalence of violence against the vulnerable and marginalized populations in the communities. We are still working on that. She'll choose one population. And also, we also want to look at the contextual factors. What are the factors contributing to violence against this marginalized and or vulnerable population, particularly women and children? Also, I want also to look at the knowledge and beliefs, knowledge and beliefs and attitude of nurses in managing issues of violence. So students will be able to select amongst these objectives. And also to look at the level of access. How do people access those marginalized communities who are abused? How do they access the services? And that is level of access to healthcare services. And also, how can the best practices available, how can the best practices available to support victims, or what are these best practices available to support victims of violence? Looking at the population I have mentioned, and also the strategies. So for the PhD, one will develop strategies to support victims of violence against the vulnerable, depending on whatever population one has selected. And also maybe develop a program for professional nurses. Professional nurses, like I mentioned earlier in the beginning, that in most cases in our curriculum, the way the nurses are taught, it is not a full module as such on prevention of gender-based violence. As such, you find that there are gaps when we teach our young nurses, especially in the undergraduate program. So that is why I think when one comes out to do a master's or a PhD, one can look at how the nurses can be taught, how the nurses can be taught, or just to provide a holistic care to victims of violence against vulnerable populations or marginalized people. So I think these are broad objectives in my research program, which I'm looking forward to getting students who will get into these objectives and make a difference. And let me get into the programs for staff. Because I'm in this position, I cannot look at myself alone. I have the following staff members, the three doctors. The first one is I have the school director, who is also a researcher, and also his research program is on development and promotion of spirituality in nursing education and practice. And already he also has students who are focusing on the research questions and objectives from his research program. And we also have Dr. Kovani, who is also having a research program and objectives outlined, already waiting for students to grab some of these objectives. And her program is on interventions to address mental health challenges during the perinatal period. Okay. And also Prof Moagi, who is a mental health care nurse, a specialist, and her research program is on promotion of mental health programs to enhance communities' well-being in South Africa. She made it broad so that that can accommodate people from other provinces. And also Prof Sihularo, who is his program is on strategies for effective implementation of mental health laws in South Africa. I think this is a new area, and I think I really, really think you'll go far with this research program. More so that it is venturing into a new area in mental health and in nursing. And also, we also have Prof Kul, who is a renowned researcher, and her program is on strengthening the resilience of professional nurses, healthcare givers, and risk groups. And also Dr. Bam, who is having a research program on strengthening wellness programs for adolescent and young women living with HIV and related chronic diseases. And the last one is Dr. Sarapelwani, who's looking at research program is on development and promotion of access to rural healthcare facilities, South Africa, the South African perspective. I think these research programs, we organized a workshop on how to develop a research program last year. And so this is a new thing we are just starting, and I think it is working well now. I will just have to nurture it and make sure that it is a success. Each one of them has their own research questions and objectives. And I think that is where it all starts. And then all these research programs forms a research program for the school. Because then for the nursing school, Mafikeng, yes. And I think that is, initially, maybe I should let you know that we have an abbreviation which is WARAS, although we wanted to look at it. And it stands for Wellness and Healthcare Access in Rural African Settings. And I think it encompasses all the research programs that we have discussed. Yes. Now let me come to students, if you allow me to.
Yes.
We have master students. Now that we are an aligned school, we are one university with 3 campuses, Val campus, Poch campus, and Mafikeng. And now, because the alignment was slowly being realized, but now I think we are now settling into this alignment issue. And now we are supervising students together. We admit students into the master's program and also into the PhD program. And we look at the expertise and we allocate students in at Poch. And although Val, they are still starting, and it will the nursing school, the research director, deputy director is there, but the school is just starting. It has not well developed, but at least it is starting. But for us, Mafikeng and Poch, we have a team where we're working together. We are sharing students, we are sharing expertise, and I think it works well, because you can imagine when you really share expertise, it is for the benefit of the school and for the benefit of the students. And now, how do we communicate with students? We have created a research journey. Currently, we have an active research director who is really, we are really working well with her. You know, we always have 2 weekly meetings to discuss the issues of research. And I can say right now, all systems are well. Yeah, so we have developed an Ifundi site for the students, and we call it a postgraduate journey, where we all of us as the researchers, we have if we want to check on the students, we go to that Ifundi site, and we can see the students are also loaded on the Ifundi, and we are able to communicate and see the progress. And when you go to the Ifundi side, you also come across the progress, or you also come across the specialities of the researchers or supervisors. And when coming to PhD, I also want to say we are sharing the services, we are sharing this expertise. And at the moment, I think I have how many PhD students? I think I have 5 PhD students, and 1 will be submitting in May. she's rounding up. She'll be submitting soon. And the other student, the other two students are busy with the scoping review chapter 2. They've gone through ethics, and I think that is good progress. And the other one is, the other two students are at ethics. And I think they're progressing well. I think one is to work well with the students and push and make sure that they complete within the expected time so that the university can also get some kind of subsidy. Yes. And I think because of lack of capacity, we have too many students, and you can imagine, I'm pairing myself with these new researchers, and I'm co-supervising them. And I think at the moment, I have about 12 master students where I am co-supervising, but 5 I'm the main supervisor. Yes. And I'm hoping that the students will work well. But at the moment, our students are doing, the first years are doing SLP with Optensia, where they're doing a short learning program on research methodology. I believe that is also helping them to get into the language of research. And when they come to the supervisors, at least they know and have gone through the basic concepts of research. And I think, yeah, I don't know what else. Maybe I should not take too much of the time.
You are sharing such meaningful information. Thank you so much for that. Firstly, I would like to say that it seems that you and your colleagues are doing very meaningful research in your research program. So all of the best with that. And it's a wonderful example for us in NuMIQ that we can follow and learn from you in developing research programs and also such meaningful research topics. I think you are tackling salient topics that's really necessary to look at in our community.
Yes. I must also say, sorry, I forgot to mention the Prof Sedin Kutse, the SART chair.
Yes.
We are really, really blessed to have the person in our school who is a SART chair, and she has a good program that she is following, and currently we'll be having a meeting on the 21st of April together. You can see she's stationed at Poch, but yeah, we'll be working. Already she has collected data and we'll be working together. I think it will be a good thing.
No, definitely. Yes. Yes. And that is the second thing I want to say, is to say that people listening to our conversation who are interested in doing research with us, to be a master's degree student or a PhD student with us, I think you now have furnished them with much information. I think you have inspired and motivated them, and also our current students, to come and study with us and to keep on studying with us. I think we are in a good place. I agree with you. And so people are welcome to come and have a look at our website and our programs that we offer. And I think you offered a good overview of what is happening in NuMIQ. And so if people are interested, you are welcome to contact Prof Salaminah or then Professor Belma Libbe in NuMIQ if you're interested to come and study with us. Thank you so much, Prof Salaminah. I appreciate your time and your wisdom, and all of the best with your work. Thank you.
Thank you very much, Professor.
Thank you.